helping make your life easier. Moms Every Day.
Hey, welcome to Moms Every Day. I'm Hattie Cheek. We have Dr. Joe DeLapa with us today from Cabell Huntington Hospital. We are going to be talking about the association between obesity and pain. Now, what is that association? Is it strong?
Yeah, thanks, Hattie. Actually, there is some evidence that obesity can contribute to chronic pain conditions.
Chronic pain conditions.
Exactly, and to some degree acute pain, and we can talk a little bit more about that as well. As you know, obesity is a very serious health condition, and actually every decade it seems like it's increasing in prevalence. In the state of West Virginia, the prevalence is estimated to be anywhere from 30% or so of people are obese.
So we're nearing 50% if it keeps going up.
Yeah, it's very common, and a lot of that has to do with just increased caloric intake and lack of exercise. But it also leads to a lot of chronic health conditions that are very serious, such as coronary artery disease, high blood pressure, type 2 or adult onset diabetes, sleep apnea, fibromyalgia. So there's a lot of aspects of obesity that can be attributed to serious health conditions that then can also contribute to pain, let alone just the mechanical stress of the excess weight on the joints of the low back, the discs, and the hips and the knees. So there's a lot of different components that can contribute.
And that's what I thought you were actually going to bring up, the stress on the joints and the discs and everything else that you're carrying around extra weight.
That's one component. I mean, obesity and pain tie together. It's somewhat more of a multifactorial approach, which means that there's just a lot of different aspects. I mean, from the health conditions that I mentioned earlier, like diabetes, patients that are obese can develop adult onset diabetes, and that in itself is a serious health condition, let alone the fact that you can develop a condition called diabetic neuropathy, which leads to like a burning sensation of pain in the lower extremities and upper extremities, and that can lead to chronic pain. It is treatable, and there are a lot of things to consider, so that's one thing to certainly think about, plus several other health conditions too. Another very common type of pain that can develop, like we talked about, is with the mechanical stress on the low back, where patients are more prone to develop arthritis in the joints of the back or in the hips, and also degenerative disc disease, which is more of like
oh my goodness,
a pressure on the discs that can cause a lot of pain conditions. I mean, potentially you might need to have surgery actually. Some of these can significantly be reversed by weight loss, and that's just something that is very important to realize when it comes to obesity.
One of the harder things to do.
It is. It's very hard, and you know, there's a lot of things to take into consideration to try to reverse that, and that just comes down to some lifestyle modification choices, such as decreasing your caloric intake, reduction of like high sugar foods, fat type of foods, and also like an aerobic type of exercise that might try to burn more calories. I would certainly talk with your primary doctor prior to that, though, just to make sure you're okay with that.
Now, does obesity, we talked about how it affects your pain, but you also mentioned somewhere in there that it would affect sleep? Yes,
it can actually. There's a strong link between obesity and a condition called obstructive sleep apnea. And what that basically is that during sleep you have repetitive pauses in your breathing, and that actually decreases your oxygen level, and what happens is your body is having intermittent episodes of almost you're waking up during your sleep and you might not even realize it.
And you don't even know it.
And some of the common symptoms and signs are that somebody might have told you that you snore very loudly, you're very tired during the day, you have high blood pressure is another very common finding. But what that does is when you don't get a proper amount of sleep at night, from the pain perspective, is that during sleep, especially the deeper phases of sleep, that's when you're having a restorative period. And if you don't ever get to that level and you're constantly being woken up by this snoring and apneic episodes, during the day you're going to have a heightened awareness of your pain. I mean, you can imagine you're not going to feel very comfortable.
Yeah, it kind of just doubles it.
And there's a strong tie-in with that as well with patients who have potentially fibromyalgia. They don't sleep well, so there may be some correlation with that as well.
Right, with fibromyalgia.
Yeah, exactly.
So people who are facing that, I mean, obesity just adds to it.
Yeah, absolutely. I mean, there is some relationship between fibromyalgia and obesity. I'm not 100%, but there is that type of correlation. And one of the things is they don't have proper sleep. And fibromyalgia also has a lot of other other associated conditions where just the diffuse pain, there are a lot of different aspects that's taken into consideration too. And there's a lot of treatment options for that as well.
And they can just come to see you for those?
Yeah, absolutely. I mean, at Cabell Pain Center, we have a very broad spectrum of different approaches to treat patients that have all these different health conditions. From either at the pain center, we can have see by one of the specialists, the physical therapist. We even have psychologists to help with the depressive side of that, and we have all our specialists from other fields.
All right, well, great. If you guys need any more information, you can just head to our website, click on the Moms Everyday tab, and then make sure that you download our app for a lot of good stuff. Now, we will be back here for more Moms tomorrow, so make sure you come to see us then. We'll see you.